the JAMA Network.
I'm David Nathan. I am the director of the Diabetes Center at the Massachusetts General Hospital and a professor of medicine at Harvard Medical School. I also co-chair the Diabetes Control and Complications Trial and its long-term follow-up, the EDIC study, as it's called. The Diabetes Control and Complications Trial is one of the signal studies in type 1 diabetes. It began in 1983 and continues on today with us following the vast majority of the patients who originally volunteered for that controlled clinical trial. The original trial started in 1983, and it was directed at examining whether intensive therapy, intensive diabetes therapy, directed at lowering blood sugar levels to the near normal range, would benefit patients with type 1 diabetes with regard to all of the long-term complications that they otherwise suffer. We looked at retinopathy as the primary outcome, but also examined nephropathy, neuropathy, and later on in the course of the study, heart disease. The original population had type 1 diabetes, were generally healthy and between the ages of 13 and 40. When the main results of the Dcct, this randomized trial, emerged in 1993, we compared the intensive treatment group to a randomized control group and discovered that all of the complications we had studied, the microvascular complications, had been reduced by anywhere from 30% to more than 60%. So eye disease, nerve disease, and kidney disease all reduced substantially. It was important to know also that we had two different groups within the study, one of which had no complications at baseline. And in them, we prevented complications from developing. In the group that had some complications at baseline, we slowed their progression. So the Dcct ended with a great message that intensive therapy was important in reducing microvascular complications. The further follow-up of the study over the last more than 20 years has shown that not only were the early stages of these complications reduced, but also falling GFR was reduced. Need for surgery, eye surgery, need for laser treatment, all of those more severe outcomes were also reduced. In 2005, we showed that heart disease was reduced by almost 60%, 60%, which was really quite dramatic. The objective of the current paper was to examine whether the original intensive treatment group, treated for about 7 years between 1983 and the early 1990s, would have a different mortality than the conventional treatment group that was treated with much less stringent diabetes control during that same period of time. It turns out that the result shows that there's a reduction in mortality even after approximately 7 years of intensive diabetes therapy. The conclusion of this study is that intensive therapy not only reduces microvascular complications, kidney disease, eye disease, nerve disease, and also cardiovascular complications, but also results in a reduction, a substantial reduction in mortality. The numbers are small in the sense that we have relatively few deaths, but the results are statistically significant, and there's about a 33% reduction in mortality. Going forward, we have this incredibly loyal cohort of patients. There are many features of diabetes that we still need to look at. We're trying to figure out the mechanisms of these effects over time. We're looking at a variety of other complications that are newly described. This population is starting to reach middle age now. They started with an average age in the 20s, and now, 30 years later, their average age is in the 50s, and we're starting to see age-related changes. I mean, things like, cognitive changes and functional changes. So we are very interested in seeing what the long-term course of intensive therapy is. And also, this is the most, the longest followed cohort of type 1 diabetes probably anywhere in the world. And so we're just looking to also to see what the clinical course of diabetes is in the modern day.